Good morning, everyone. My name is Mehak and my group number is 4. For this assessment, we have taken the policy called the Physical Activity Promotion Policy. I'm going to give you a brief introduction about the policy today. It is a comprehensive policy aimed at promoting physical activity and well being in children. The policy provides guidelines for the center staff to encourage children to engage in physical activities that are appropriate for their age and development. The policy is essential to ensure that children grow up to be healthy and active individuals who have skills to participate in physical activities and maintain a healthy lifestyle. The policy emphasizes the importance of outdoor play, active play, structured physical activities like dance and sports. The policy requires the center staff to regularly assess the physical activity levels in children of their age and develop individualized plan to promote physical activity. The staff use different methods to assess children's physical activity levels. Based on these assessments, staff develop plan for each child to consider their age, developmental stage, interest and abilities. The policy encourages parents to support physical activities at home and provide resources to help parents incorporate physical activity into their children's daily routine. The center staff also work with disabled child, family, and healthcare providers to develop individualized plans for them as well. The policy ensures safety of children during physical activity and addresses the needs of children with disabilities. In conclusion, it aims to create a safe and stimulating environment that encourages children to be physically active and develop healthy habits that will benefit them throughout their lives. Thank you.
Hi, my name is Maggie and I'm in Group 4. Today, this policy we chose has been promoted with the physical activity, health and well-being by using the integrated teaching and learning approaches. They use the child-directed and guided play. They will listen to the children and understand what's based on their interest to provide the physical activities for part of their policy and in their program. They will create physical and social environments that expose children to learning experiences and physical activity, both indoors and outdoors in the natural world. According to the VIA World F, this policy will focus more on outcome 4, as they believe that children are confident and involved learners. Children are active learners through exploring the world through touch, sight, sound, taste, smell, and movement. They are motivated and resourceful in approaching new learning and taking part in new challenges. They develop and use their imagination and curiosity as they build a toolkit of skills and processes to support problem solving, hypothesizing, experimenting, researching, and investigating activity. With the pedagogical approaches to young children, learning have been influenced by the value and beliefs predominating at different times across different cultures. The principle of young children's learning tended to conceptualize a universal child, passive and open to being molded or shaped by the environment and the individuals within the environment. The children typically feel encouraged to repeat actions when those actions meet with praise and approval from adults. Therefore, this policy will provide regular opportunities for outdoor play. This will encourage children to become more active learners and easier to build up their confidence through play. And this will lead through to place-based approach, which for both social and physical environments influence their health and well-being. Children's daily experience of living in the environment around them is a significant factor with their overall well-being.
Hi there, my name is Ritik and today I'm going to talk about the physical activity policy. The policy depicts physical activity promotion and influences the teaching practice to adopt these regulations while teaching and working in early learning setup. It recommends adopting a healthy lifestyle which includes healthy eating and physical activity. It is crucial to promote physical exercise in young children, as young children who are very active are more likely to be active throughout the childhood. And the early formation of positive habit may supply the groundwork for later years. Regular physical activity in childhood can also have an impact on both short and long-term health consequences. Together, parents and teachers can share the burden of prioritizing physical activity both inside and outside of the house. Infants, toddlers, and preschooler should not be sedentary, restrained, or kept inactive for more than 1 hour at a time except for sleeping. A poster-sized summary of the policy can be displayed so parents see that healthy eating and physical activity are important to the setting. Alternatively, the policy can be spread over several posters with different points from the policy displayed over time. The goal of the policy is to prioritize safe, active play for children to ensure staff, carer, children and families are aware of the benefit of daily activity like active play. Furthermore, early exposure to sedentary screen time can affect a child's development over the time. Early childhood education settings in Australia aims to support children's health and well-being by promoting healthy eating habits, physical activity and hygiene practices. Educators work collaboratively with families and health professionals to show and address any health concerns that may impact a child's learning and development. Thank you.
Hi, my name is Sachin and I am from group number 4. We are working on physical activity promotion policy and we have divided work in 4 parts, and I am comparing the policy ideas to concepts and literature. I have done a study from Mitchell Institute for Education and Health Policy at Victoria University. I found that it is one of the leading health think tank in Australia. It means to not only improve the Australian healthcare system but also the education sector by offering a range of services so that more Australians can benefit by engaging in physical activities and support. And if I compare the policy ideas, concept and literature, this policy identifies and seeks to address of underlying causes of poor health, offers physical and social and environmental policies which promote good health through the maximization of general platforms in the community. Above all, the policy acknowledges the lack of support participating in physical activities as the single most cause of poverty, obesity among children. The policy approaches to the development of physical and support activities comes at a critical time, as studies show that young children in Australia have low and very low rate of exercising and participating outdoor activities and other physical